What about fibroid? See, what is your, fibroid is a very common thing, so that's why I'm in the reference to the fibroid. How you will manage this patient?
So, fibroids, usually when we encounter fibroids, there's more than one fibroid involving the uterus. Third asta, ek, don, teen, and not all fibroids you might be able to see on ultrasound. So, people are using other modalities, MRI. But when we go in there, we might find two fibroids sitting close to one another, you know, and we have to take. So, what is also important is not just removing the fibroids to reduce the whole size of the uterus, but avoiding the inner cavity of the uterus, the endometrium, where the uterine cavity, where the baby is supposed to grow in there. So we try to avoid damage to that. So this helps us being very, very precise. I think precision, visualization, reducing bleeding and trauma is probably the biggest advantages of robotic surgery over routine laparoscopic or even open surgery. Open surgery, we all know now, the recovery is longer, the bleeding is more, the risks of infections are higher as well. So definitely there's a role. And you did say that the future lies in implementing or getting this technology in all areas of the world. So not just the bigger cities, but even the remote areas. Now, the biggest advantage of robotic surgery and artificial intelligence is someone is operating in a remote village where there is no super specialized surgeon and they encounter difficulties. Someone sitting in Bombay or Delhi or even in New York or London can look into it and help guide the surgeon who's operating in a remote village somewhere, guide them into, you know, this and
so exactly what
remotely,
to be done.
Exactly. Tell them what is to be done and tell them, all right, that bowel looks fine, leave it alone, or that needs suturing, stitch that up, and this is what we do. So when we do open surgery, we take stitches like this. But with robotic down, it's just small, fine movement. So there's no tearing, there's no damage, there's less risks to surrounding structures. Like I was saying, nerve sparing. Yeah.